This is case of the day, and we're on 127th case. I still can't believe that I've been able to do this, and it's almost now 8 months. My God. So this is the last case for the week, and I'll be back with 128 next Monday. But today's title is Maxillary Sinus Biopsy. So this 55-year-old was treated for left buccal carcinoma with surgery, radiotherapy, had left maxillary pain, and a PET CT showed a lesion here in the left posterolateral maxillary sinus wall, and that's it. There was nothing else. So the patient was referred for a CT guided biopsy, and I was wondering what the approach would be. Now, you could actually just go through the anterior wall. It doesn't make sense to go through the zygomatic arch. But when I was thinking about it, I realized that if I just placed the patient right side down, there was a nice angled approach that I would be able to take to biopsy this. And so this was the plan. Decided to go with this yellow line approach, and so the patient was right side down. I decided that this is how I would do it. This is at the time of biopsy, but because of the way the anatomy would have changed with a little bit of obliquity, suddenly this route opened up, and so this is a subzygomatic approach straight into the soft tissue involving the posterolateral maxillary sinus wall. And so then that's what I did. I used an 18 gauge Cook short, that 5 centimeter, 10 millimeter throw, just placed the cannula here, deployed the gun, took about 6 cores. I think the whole procedure took about 7 minutes or so, and that was it. And the reason I put this up is because a report came a couple of hours ago, and it's squamous cell carcinoma. Now, at ctbiopsy.com, I've been looking at suprahyoid biopsies for now over 4 years. We started with this case 23, and the last one was 149, I think about 3 or 4 months ago. And if you summarize these, then this is how you have these various approaches. So you do have posterior prone or decubitus approaches, but most of them would be anterior, either supine straight, head turned, or as in this patient, we actually had him lie decubitus with his head supported. And transoral is something we don't do, but otherwise the intrasinus, supra, subzygomatic, paramaxillary, then these are all the various approaches that are listed here. And just a couple of examples. This was the intrasinus I did, and the reason the oncologist sent this to me was because the patient couldn't afford to go to an ENT surgeon and then get a procedure done, etc. And I just thought this was so simple and straightforward that I couldn't find any literature on a CT guided maxillary sinus biopsy, but it's so straightforward. I mean, and then you have these subzygomatic approaches. The one that I used currently was for the maxillary sinus wall, but you can do it for masticator space. And here I've done it for a recurrent a sphenoid adenoid cystic carcinoma. And you have a lot of these approaches that are there. And so to add to that is this one where I've approached the posterolateral maxillary sinus wall. But in the suprahyoid neck, typically in most of the spaces, if you know the anatomy and you know the safe approach avoiding vessels and nerves, you usually can get a needle inside. So it's just something that we need to remember. That's my WhatsApp channel. Thank you so much for viewing this.